Hi there, how are you? Thank you very much for coming down today. Now today we're going to be doing a cranial nerve exam, and this involves testing your eyesight, your sense of smell, your sense of hearing, and we're going to be testing your sense of touch as well, okay? Now, I think we shall start with the eyesight. Okay, so I want you to relax yourself, and I want you to just focus on my finger now, okay? And just as I'm coming closer, okay, just focus on it as I'm coming closer, and I want you to focus on it as I'm coming back. I'm now going over this way. Keep looking at it, and I'm now going to come over this way. That's excellent, and back over. Okay, that's lovely. I'm going to put both my hands up now, okay? And I want you to tell me which fingers you see moving. Okay, excellent. And again. Wonderful. Okay. That's wonderful. I'm now going to put one down here and one up here, okay? And if you keep looking straight ahead and just focus on the tip of my nose. That's wonderful. That's wonderful. Excellent. 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 Okay. I want you to tell me how many fingers that I'm holding up now, okay? That's wonderful. That's two. Two. That's two. That's four. That's four. That's two. Excellent. I want you to just very carefully watch these fingers as they move. Okay. How are you there? How are you finding the sudden movement? Are you finding that your eyes are able to track that? Yes? That all looks absolutely fine. That's wonderful. Thank you very much. Okay. Now, I'm actually going to present you with a range of coloured objects, okay? I want you just to tell me the colour that you see, okay? That's black. That's wonderful. It's a kind of creamy beige. Excellent. Dark blue. Wonderful. And that's red. Excellent. That's absolutely brilliant. Well done. Okay. Now, what I want to do is I want you to look at this hand here, up here, and I want you to look at this hand up here. Okay, so look at this one, look at this one, okay. Then I want you to look straight at my nose, okay. And when I wiggle my finger, I want you to tell me which one I'm doing, so just point at it, okay? Okay. Excellent. Excellent. And we'll try that again. Look straight at my nose, tell me which finger I'm going to wiggle. Excellent. Excellent. Well done. That's absolutely brilliant. Well, your eyesight looks absolutely fine now. Okay. What I'm going to be doing next is we can test your sense of smell. Okay. And all I want you to do is just tell me the smells that you smell, okay? move around a little bit. You like that sound? It's a nice sound, isn't it? Yes. Okay, and what smell did you think you could smell there? Vanilla, that's absolutely brilliant, wonderful. Okay, I'm going to spray the next one now. And just take a moment to smell that smell. And tell me what you think that was, okay? You like that sound? Excellent. It's a very nice sound, isn't it? And what did you think that sound or smell was? Sorry. Lavender. That's brilliant. Excellent. Okay. We just got one more, okay? Just like that. Oh, it's a nice smell, isn't it? Yes, that is. Oh, you would like to hear it, would you? Me tapping on this, would you? I can do that. Yes, I don't mind tapping on them for you. It's a very nice sound, isn't it? What did you think that smell was there? Apple. Absolutely correct. That's brilliant. Well, from what I can see, or from what I can smell, from what I can see there, your sense of smell is absolutely fine. Okay, so I think what we'll do next is we will do some touch sensation exercises, and we'll see what the touch sensation's like, okay? And that'll be in your face, and that'll be in your shoulders, on your elbows, and on your hands, okay? After that, we're going to do the hearing, and we're going to be testing your hearing coming from this side, and we're going to be testing your hearing coming from this side. So it'll be, okay. Okay, now what I'm going to do to test the touch sensation in your face is I'm going to use this very small brush, okay? And what I'm going to do is just very gently brush along the top of your forehead first, okay? So you just completely relax. That's right. Completely relax there. And how does that feel? Does that feel okay? You can feel that fine? And does it feel the same on this side as it does on this side? Excellent. Okay, I'm just going to come down and brush down the sides of your cheeks, okay? And the same thing, I want you to tell me if you can feel the same, if it feels the same on one side and the other. So we're going to start on this side, okay? And you just completely relax there. How does that feel? Can you feel that the same way that you did on your forehead? That's brilliant, excellent. Okay, so we're just going to do the other side. I want you to try and think if it feels roughly the same pressure there and sensitivity. Does that feel roughly the same? Excellent, that's brilliant, that's great news. Okay, what I'm going to do is just very gently brush your nose, and I'm going to do the middle of the nose. I'm going to come down around now and just do this side, and I'm going to come and do this side as well. Okay, and how does that feel? Did that feel roughly the same on the middle and the sides? Excellent, that's brilliant news. Well, what I want you to do now, I'm just going to pop that brush down. So you lean forward and just pop your left arm forward for me. Okay. I'm just going to very gently squeeze the top of your shoulder. Alright. So just going to very gently squeeze that there. Okay, does that feel okay? Okay, and I'm just going to come down and very gently squeeze your elbow there. Okay. And how does that feel? Does it feel okay? Excellent. I'm just going to come down now and just squeeze the back of your hand. Okay. And how does that feel? Excellent. What I'd like you to do is I'd like you to just put your hand like this, and I want you to push back as hard as you can, and I'm going to try and push this way. Okay. You're just trying that now, so just push back as hard as you can. That's excellent. Now what I want you to do is I want you to do it the other way, so I want you to push in the other direction there. Okay. So if you just push as hard as you can. That's excellent. Brilliant. Okay. Now if you just like to pop your right arm out for me. That's wonderful. And what I'm going to do is I'm just going to very gently squeeze your shoulder on your right arm there, the top of your right arm. Okay. And how does that feel? Excellent. So you can feel that perfectly fine. There's no pain or discomfort there at all. Wonderful. And I'm just going to do the same thing here. I'm just going to squeeze your elbow. Okay. Excellent. How does that feel? Is that okay? Excellent. Just come down onto your hand. And just squeeze your hand there. And how did that feel? Okay, there's no soreness there, aching or anything. Okay, and we're just going to do the same thing we did before with your hand, alright? So I'd just like you to push back, same thing. If you have it like that, you just push back that way as hard as you can. And I'm going to push in the other direction, okay? That's absolutely wonderful. And if you could just do that the other way. That's absolutely wonderful. Okay, now if you just place both of your hands onto mine there, what I would like you to do is I'd like you to try and push your hands down, okay, and I'm going to push them up. Okay, so push them down as hard as you can. That's wonderful. And I'm going to place my hands on top of your hands, and I'd like you to just try and raise your hands up, and I'll push them down. Excellent. That's absolutely brilliant. Well done. Okay, what I'd like you to do is with your left hand, I'd like you to just push against mine, okay? So we'll just put them together like that. If you just push against my hand with your left hand there, just as hard as you can, that's absolutely wonderful. What I'd like you to do is do the same thing here. If you could just push against my hand as hard as you can with your right hand. That's absolutely wonderful. Excellent. What I'd like you to do is get your arms down by your side and just have your elbows just close into you, okay? Then I want you to bring your hands up like this. So I show you, so if you bring your hands up with your elbows in like that, okay? That's excellent. What I want you to do is I'm going to put some light pressure and I want you to try and push out with your elbow like this, as hard as you can, keeping it straight down, and just push it outwards like that, alright? Okay, that's wonderful. And I want you to do the same with this arm. That's wonderful. Excellent. No, that's great. Okay. Now, what I want you to do is I want you to just lift up your left leg. Alright. And in the seated position that you're in. And what I want you to do is I want you to just raise your knee. And I'm just going to push down on your knee, okay? And just try and push against it. That's wonderful. And also, I'm just going to lift your leg up. If you could just, with your foot, if you could just try and push your foot forward like that. That's excellent. And if you could try, from your foot being flat, if you could try and just curve your foot back up. That's wonderful. We're going to do the same thing on this side, okay? So if you just, with your knee, if you just try and raise your knee up there. That's wonderful. And with your legs, same thing. We're just going to go the one way with the foot. Excellent. And the other way. That's brilliant. That's absolutely great. So all your touch sensitivity and your legs and all that seem absolutely fine. What I'm going to do is I'm just going to roll this down your arm like this, okay? Got these little balls on it that roll along, okay? And I want you to just tell me if you can feel that all the way down, okay? Can you feel that? That's lovely. And we're going to go on the inside of the arm as well. That's lovely, all the way down to the hand. And we're just going to do the same thing on the other side, okay? That's the outside of the arm. Can you feel that alright? That's wonderful. We're just going to do that on the inside of the arm. All the way down to the hand. That's wonderful. Excellent. Okay, now I'm just going to tap very gently on your shoulder, your elbow and your hand, and then on the top of your hip, your knee and your ankle, okay? So just very gently. You feel that okay? And here. You feel that okay? And here. Can you feel that okay? And here. Excellent. And here. Excellent. And here. That's wonderful. We're just going to do the same on this side, okay? On your shoulder. Excellent. Elbow. Excellent. Hand. Wonderful. Top of the hip. Wonderful. Knee. Excellent. And your foot. That's brilliant. That all looks absolutely fine. So what we're going to do now, so we've done your eyesight test, we've done your sense of smell, and we've done your touch sensitivity, okay, and your reactions. And what we're going to do now is we're just going to finish up with a hearing test, okay? Excellent. So we've got our hat again. Remember the red hat? And what I'm going to do is I'm just going to make some noise in this side and then some noise in the other side, and I just want you to tell me if you can hear it roughly the same, okay? And we're going to do the same in this ear, okay? And how did you find that? Did you hear that roughly the same, both ears at the same level? That's absolutely brilliant. Just going to click this mouse. And we're going to do the same in the other ear there, okay? And how did you find that? Did you hear that the same in both ears? That's wonderful. Okay, next we're just going to tap very gently on this little box, okay? Okay, we're going to do the other ear. And how was that? Could you hear that at the same level in both ears? That's brilliant. That's great news. Okay, the last thing we're going to do is just this little deck of cards, okay? I'm just going to flicker them like that. I'm going to do the same in the other ear, alright? Just check that. How did you find that? Did you hear that at the same level in both ears? Oh, that's wonderful. Well, you've done very well, and everything looks absolutely fine. But do join me again in, say, 6 months if you'd like to, and we can just check it over again. But it all looks absolutely fine, okay? Thank you very much for coming down, and I hope you have a wonderful day. Okay, I'll see you later. Goodbye.